What's the science behind your decision going from 25 to 15?
Two things. One, signaling. You know, there's no magic number, but we learned when we went from 15 to 25, we started to see problems. And when they went through the deep case investigation of 4,000 people, the 4,000 cases, a lot of people couldn't remember how many people were at the party or the names of everyone at the party. We never saw that when the social distance limit, when the gathering limit was 15. So at 15, it's a manageable number of people. You pretty much remember who is there, and it's just generally more contained.
So you spent 10 minutes outlining your concerns with restaurants and bars, and Dr. Scott just reinforced some of that. What about protests? What's your directive to protesters? Keep it to 15? And how do you enforce that when you see large crowds? You're telling restaurants, you're going in and the DVR is citing restaurants. What's happening across the street here when you have hundreds, if not thousands, of people gathering?
It's a great question, because I was quite worried when we had the big protests, whenever it was, a month or two ago, with 10,000 people. We saw almost no cases on account of these protests. Now, our theory is that that's because everyone had a mask on. So, had we seen cases, we might be doing something different. But we've tracked these protests, and we haven't seen a lot of cases attributable to them. Now, we were there passing out masks. We are there passing out masks for all the protests. What we're finding is that when people party, they don't wear a mask. You know?
At the same time, your directive is no more than 15.
Correct.
So what about people who are deciding to gather as protesters? What do you tell them now?
Same thing. I think, look, it's a risk, and any gathering over 15, indoors or outdoors, is a risk. You should wear your mask. But what we have decided is that, you know, people have a First Amendment right to express their views. So we've enforced it, right? We've passed out masks, we've enforced distancing, but we haven't shut down any protests. And we haven't seen any cases, so I don't see any need to.
Just one other question while I have you shifting gears. 2 weeks ago, you said the application for small businesses would be ready in 2 weeks. Where are we on that?
Today. It goes up today.
And what goes up?
An application. So it'll be up online today, an application, start to fill it out. I believe Commerce is going to have folks available to help if you're a very small business and you need a hand. And they're hoping to start getting the money out the door, I think, next week.
Is it still first come, first serve?
Yes.
Shutting down a business as a result of not following procedures, I won't call it draconian, but is obviously a severe step and may end up resulting, unfortunately, in the death of that business. As such, are the folks who are inspectors, are they observing, if you will, police standards of evidence, due cause, probable cause, and what is the appeal process for this?
Yeah. So you'd have to ask Liz Tanner, who runs Department of Business Regulation. They have been excellent about due process. They have gone back on numerous occasions, giving warnings to the same establishments, offering assistance around how they can improve. And look, if after a couple of visits there's no improvement, then they're given their compliance order.
But you're setting the specter of setting up tip lines, unfortunately, in today's heated climate, creates the specter, if you will, of folks diming each other out, neighbors telling on neighbors.
But it's very easy to fix it. Comply. Put up your plexiglass. Shut down your bar. You could fix it in a minute or a day.
There's plenty of cases already, they're starting to surface anecdotally of he said, she said. So I'm just wondering, is there going to be an appeal process, and is this public information in terms of the evidence?
Yes, there is an appeal process. The metrics are online. The compliance orders are online. Everything is transparent. And by the way, for weeks, we have resisted this. The plan is not to shut businesses down. But the fact of the matter is we're seeing a problem. It relates to your question. This is where the cases are coming from, so we have to do something. Otherwise, we're going to have to claw back all businesses, and that's the last thing I want to do.
Dr. Alexander Scott, sort of going back to Jim's question on the science, are we seeing any trends where severe cases, maybe folks on ventilators, deaths, I know that's not the case, but in general, where these bar and restaurant situations or any other situations that are creating an unsafe dynamic are resulting in severe outcomes? Are we seeing an increase there, or are we sort of in the same place that we've been for the last few months, where the most severe outcomes are largely older folks?
As we've mentioned, hospitalizations have been slowly increasing, but are still on the low level. If you're considering hospitalizations, severe outcomes, there's oftentimes a lag when we see them, but we haven't seen as much of the change. What we are seeing is increases in cases among people who are 20 to 39 years old. Those cases are significant in the sense that the way COVID transmission works, someone may be infected, particularly if they're younger, they may not know it, but be exposing someone who is higher risk, someone who is more senior, someone who has underlying illnesses, whether or not they know it. And you don't have to be significantly older to fall into one of those categories, 40s, 50s, 60s. We would continue to see a trend with hospitalizations if we don't change what's happening right now. So that's what our critical point is today.
What's your message? There's this protest scheduled for Saturday. There, I guess by the standards here, they would be able to have 200 people gathered because it's an outdoor event, or 250, pardon me. Is there, going to be some sort of compliance officers there, or how are you, from a medical standpoint, sort of measuring how to handle an event of that nature?
Our key focus is for people to follow the rules. That's why we cannot emphasize enough that what is happening is preventable. Wearing a mask makes a difference. That's the bottom line we want everyone to understand. We've learned, we've evolved in our understanding through this pandemic. Wearing a mask absolutely makes a difference. If you're in a social gathering and people do not have on masks, if you have one on and you're not wearing it properly, covering your mouth and your nose, if you see a place where it's not happening properly, either remove yourself or encourage people. Get masks, give it out. If you're a business, offer it to people who are coming in. Wearing masks makes a difference.
And specifically to this protest, though, on Saturday or any other large scale events, you're comfortable with whatever number of people turn up as long as they're wearing masks and maintaining about 6 feet between each person?
As the governor shared as well, the larger the number, the higher the risk. Absolutely. So we want to always encourage smaller numbers. That's exactly why, particularly with social gatherings where we need people to wear masks better, we need that number to be as small as possible. Whether you're outside or indoors, the smaller the number, the better. No matter what, wear a mask. If you can distance, get the 6 feet of distance.
Can we talk a little bit about these numbers too, coming back to this? I mean, there are different ones when it comes to weddings. You have a certain set of numbers. Social gatherings, obviously defined differently, certain set of numbers, and then just indoor 125, outdoor 250. So you have people wondering what's the rationale behind these vast differences in these numbers. People had graduation parties planned for 40 people in their backyard, and then they can't have that, but a wedding can be out in the backyard with 40 people. So can you kind of explain that?
So, yeah, I would say, first of all, as I've said from the very beginning, there's no easy, I'm always between a rock and a hard place. There's nothing perfect. We're trying to do our best. We are going by the nature of the event. So if you have an event where people are seated, wearing masks, you have the name and phone number of every person, it's outdoors, people are distanced, that you can obviously have more people. Where we're having our challenges are where there's lots of mingling, no mask wearing, no compliance. In your backyard, it's really hard for us to enforce anything. We've seen with catered events, compliance has been good. Waiters and waitresses are all wearing masks. They're encouraging guests to wear masks. They're encouraging social distancing. They have the names and phone numbers of everyone there. So when we do contact tracing, we can be very effective. So anyway, it's just really more about the nature of the events and how much mingling there is, how much hand sanitizing there is, how controlled the event is.
And when you were also talking about schools, you made a comparison when it came to the number of positive tests, comparing that to the numbers of Florida, the numbers of Louisiana, Mississippi. Obviously, we're in a very different place than those states right now. Would a more accurate representation be comparing those to our other states in New England? And how is that comparison right now when it comes to opening schools and looking at those numbers?
I think it's similar. It's similar. Although we're also going to have to do a city-by-city analysis. So the 5 metrics I put out, we need to be in phase 3 as a state, and then each community has to be below a certain prevalence at the time we decide to reopen, that week of August 16th, and then all the other metrics.
Can you explain a little bit the positive test rate? Because we're seeing some different numbers, again, when it comes to the Johns Hopkins study versus what the state is releasing. When we get close to that 5%, what happens? As we're saying, positive rates of 5% in other states, you can't come to our state. So if we approach that, what happens, and what is the actual, can you explain that positivity rate by day?
Yeah.
Thank you. That's an excellent question. The percent positive number is one that is complex across the country. We've actually worked closely with COVID tracking, which is what Johns Hopkins references, to help them make sure we're comparing apples to apples. We are one of the few states that have shown different components to the calculation for calculating it in different ways. The way we have updated it so that it is most aligned with what other states are doing is the number of positive cases over the number of total people tested. That's more consistent with the states that are around, but we are still offering on our dashboard the other numbers that would allow for people to calculate the percent positive rate in the various formats that it can be done.
So what is the positive test rate as of right now for the state?
The 2% number that the governor shared for the state.
The city-by-city reference that the governor just made is I think, where I wanted to focus a bit. There's a discussion in the slide in the proposals for reopening the state on municipal readiness. And that seems to me a potential ticking time bomb about health equity. Because, and to clarify, the governor talked about rates per 100,000 currently, but cumulative rates per 100,000 according to the state vary radically from city to city. So you have, on the one hand, something like 5,300 per 100,000 cases in Central Falls, 3,600 per 100,000 cases in Providence, and that goes down to 200 to 500 per 100,000 in the bedroom communities, the suburbs. I think Hopkinton is the lowest with about 200 per 100,000. So logically, that suggests that if municipal readiness is a significant factor in what goes on in reopening the schools, and I'm not saying it shouldn't be, does that lead to a conclusion that we're going to have very different types of school reopenings in different cities, which we may, but that the effect of doing it that way would be that the cities and the populations in those cities least able to adapt to, say, distance learning are the ones who are going to most need to stay distance learning. I mean, if Central Falls, being the hotspot, has to stay on complete distance learning, that's the city where people are more likely to live in multi-generational housing, where people are least likely to have access to fast internet, to laptops, etc. So are we, by putting municipal readiness as a criterion, and again, not that we shouldn't, creating a situation where the state is going to have to do something to provide for the increased needs from municipalities who have lower readiness? And
Yes.
what are we going to do?
Thank you for that question. This is something that we are focused on every single day. One of the first things I can respond to with your question was address the type of rate that we will be looking at rather than a cumulative, because each city and municipality has gone through its own journey. We will be looking at a weekly, a more recent case rate so that we can better evaluate where a municipality is at this time. And to combine what has already been shared, we want to encourage going back to school, and we want to look at all of the data to make sure that we are doing it in the safest way possible. Where there are municipalities or jurisdictions that may have higher numbers, that's going to be where we will focus additional energy and resources to be able to address. We have, for example, a high-density setting support team that's analogous to the type of team that we had with congregate settings, where with partnership with the National Guard, partnership with the health equity zones and other community organizations, we're going into cities directly, municipalities that are hardest hit, ensuring that they have the resources to do the cleaning that's needed, to do the infection control changes that are needed, to be able to establish the testing that's needed. We will continue that type of focus as we are opening schools and help ensure that the municipalities that need the additional attention and resources to help ensure that their kids have the same access that kids do throughout the state, then that's what we will do.
Well, maybe the second half of my question would be better directed to the commissioner, in fact.
Yeah, so I'm glad you brought up this question because we have been planning on this. We've been looking at the numbers all along. So we have draft plans of what we're going to do differently in different communities. For example, Central Falls, you mentioned them. So what happens if they have to be at distance learning? So is there a way that we can help the family as a whole? Is there a way that there's additional tutoring, that there's additional supports? Our goal is to give more to those communities where they have been impacted the most. So it is not that they're just going to do distance learning. If that's the case, it's what are the other measures and supports that we can put in place to make sure that those students have the best education possible. And if that means getting the parents on as well and get them certified to do some work, we have the governor's program. All those things we've been looking at. The great thing about how our state has been tackling this is that we have been tackling it as a whole state. So all the agencies are working together to provide more to those communities that have been impacted. So we thought about the extra tutoring. We thought about how do we bring materials? What does the technology look like? Do we need to upgrade what's happening? All those things are part of our plan.
And finally, I'd like to direct a question specifically to the governor, which is if we do need to have additional resources that are provided to schools, is there money for that? What kind of money? Where can it come from? And do you have any comment on the situation with Congress currently negotiating the next installment of coronavirus pandemic aid? And to my understanding, the Senate Republican proposal includes almost no aid for schools unless they do in-person reopening.
Yeah. So we have allocated $50 million additionally to cities and towns to help them with the reopening. And our ability to do more than that will depend entirely on what Congress does. At the moment, it's a bit of a food fight in Washington, it would seem. And so we're just going to have to wait it out and hope that they do the right thing over the next couple of weeks.
Governor, you said you would never force a parent to send their child to school if they felt uncomfortable. The commissioner talked about flexibility. I just want to be sure that we're clear. Are you saying that even if the student doesn't have a health issue or is immunocompromised, if a parent doesn't want to send them back, even if districts are doing full in-person learning, that there's going to be an option for those families?
I think so, yes. Certainly initially. And here's why I say that. A couple of reasons. One, we've learned, we've been at this now for 5 months, 4 months, you need to give, folks have to get comfortable with it. So we saw the same thing with childcare and summer camp. Initially, some parents were reluctant, then they saw it was safe, it was happening, their friends' kids were there, and then they were able to send their children. I believe that that's the right way to do this, which is our job is to set it up, have it be safe, have an in-person option, and then give the parents some time to get comfortable rather than saying, if you don't show up, your kid's marked absent. The other thing is, here's the reality though, every school district is always going, every school district, in order to have a complete plan, has to have a plan for distance learning, because there's always going to be some kids on any given day who need distance learning. Maybe they're sick, maybe they tested positive, maybe they, just have the flu and they can't go to school, whatever. So in light of the fact that they have to have a plan anyway, and the fact that I think it's important for parents to have choice and get comfortable, I would say yes.
Based on the metrics that you've released today, if Friday wasn't July 31st, if it was August 31st, would we be able to move into full in-person learning given the current situation that the state is in?
No, well, for a number of reasons. Number one, our testing capacity, our testing ability isn't quite there yet. So as I said, one of those metrics was we have to promise every school they can get the results of a test within 2 to 3 days. We'd be hard pressed we couldn't get that done next week. If school were starting next week, no. Also, the school districts aren't ready yet. By the way, I'm not criticizing them. They have more weeks to go. We've seen their plans, their draft plans. They're good, but they have a lot more work to do. So no, we have more work to do. But I think we'll get there.
I was just looking at the new website, and there's a great FAQ section. It looks like masks will be required for everybody all the time, regardless of pods, distancing, all of that.
Yes, we are going to require masks. This is something we are hearing from a lot of teachers. They would feel safer if the children had to wear masks. And I think it's important, teachers have to be safe and feel safe. So obviously, we don't want to get into mask shaming, and we don't want to punish children, and there'll be certain kids who aren't developmentally able to, so we have to be kind. We have to have extra masks in every school. So if a kid forgets one, you just offer a mask. Bottom line is, everyone in the school should be masked.
Bouncing off that question, Massachusetts has mask breaks, designated breaks during the day, or designated areas where you can take a mask break. Is that something you're considering?
Yes, I think it's a good idea, particularly for the little kids, particularly for recess, definitely. And that's my point. All of the debate right now is so high level and political. Should they be in school or not? The reality is, yes, they should be. We have to make it safe. So then you get down to the nitty-gritty details of how do you make it safe? What's a safe school bus? What's a safe mask break? What's a safe situation? And that's where I want to keep Rhode Island, that we have those metrics, we have the 34-page guidance document. Let's get to work and see what's possible and see if we can get the kids back in school.
Dr. Alexander Scott, just one more question. I've heard from some people that want to know about the health department, whether you're going to revisit the nursing home visits for people coming in from the outside. And, it started in June, but there are some places where they've had some positive COVID tests and then everything gets shut down. And so it's kind of a back and forth, a little bit of a seesaw, and they're talking about how difficult that is because you have a loved one who gets used to seeing somebody, then they start to regress because they have been alone for all of these months, husbands, wives, separated. And so I wonder what your directive is to administrators. In one case, they were concerned because they said they immediately shut down everything when really it wasn't the people coming in from the outside who were the problem. It may have been some of the staff. So what is your directive to nursing home on visits when there are coronavirus cases found in that nursing home?
We decided to take it one step at a time, and that's why with starting visitation, we made it so that if there are cases, we want to really get our hands wrapped around it, stop visitation, make sure we understand what's going on. I'd like to continue that to make sure that we are controlling what's happening in the community overall, given the discussions that we've had today. But it is absolutely on the table, working with nursing homes to be able to see how can we move forward in a way that allows for more stability for people who are visiting. We've always known that there's a dynamic of the staffing who are from the community versus the visitors themselves, but being able to have control of the visitation, keeping it limited the way that it is, and then pulling back if we need to, just to assess if we have cases, works for right now, and we'll certainly come back to that to assess what's the next step.
I think their point is the reality is in some cases, not that the cure is worse than the problem, but you have some people who are literally dying because they're not having contact. And again, it's a 2 steps forward, 3 steps back situation. So I wonder at what point you're going to revisit that. It's been 6 weeks, almost 7 weeks, right, since you reopened for visiting?
That
June 8th?
seems longer than what it is, but time is flying. So yeah, but it's something we're constantly concerned about. It's why it was challenging to go as long as we did without visitation, but we knew it was time to start, and I appreciate you asking that because we're going to stay vigilant at seeing how can we take it to the next step while keeping people safe.
Lockdown.
Spring and out in the summer, but photos are surfacing. There's limited medical capacity out there, and we're seeing these
In Block Island, is that what you're talking about?
on New Shore. Well, relatively limited medical capacity. What's your take on the ferry, though, as far as enforcement? Are DVR inspectors going to be out there looking at that? Is that something that's on your radar screen at this point? Have you seen those photos?
Everything is on our radar. For a while, we had problems, then we get it under control. It sounds like maybe we have to get back at it and look at it. You'd have to ask Director Tanner. I don't have a feel for it. Thank you.
Commissioner, one question quickly. Clearly, there's going to be some significant physical adaptations to schools across the state. Is there going to be a bid process? Will the government be using our emergency powers? And will there be minority set-asides?
I think that's, yeah, every district is working on that right now, and some districts are working together.
But in terms of will it be something of a bid, or will they be purchased outside of a bid process?
Right now, they're within the bid process, but we're working on alternate ways of doing things.